I'm Rachel Nugent, and I'm the Deputy Director for Global Health here at the Center for Global Development. I'm going to introduce you to the problem of drug resistance. Drug resistance is a global problem. It exists in rich countries and in poor countries. I'm going to introduce it to you by telling you a story that can happen to you or me. Imagine that you're in Africa. You've planned this trip for a long time. You've gone to visit some friends from graduate school. You've gone to the country of Ghana, and you're at their home in Accra, the capital. It's a big city, a modern city, and you're having a very nice time visiting friends and seeing the sights of Accra. Your friends, after a few days, invite you to come down to visit their village, their extended family in their village of Apam on the coast. And you've heard a lot about the coast of Ghana, the seashore, the interesting slave trade sites to see. And you are eager to go down there. You go down and you enjoy visiting the family and seeing the sights. And you come back to Accra after the weekend and you start feeling a little bit sick. You go to the local clinic and you get some Cipro, some antibiotics, because you have a stomach bug. And you continue your visit with your friends, and you still feel sick after a few days. You go back to the doctor and you get some more Cipro. And after a few more days, it's time to go home. You head back home. You're still not all completely better, and so you go to your doctor back at home and say, I've got some stomach bug I picked up in Africa, probably something I ate. And you get some azithromycin from the doctor. A week later, you're feeling worse. You have fever that comes and goes. You have a bad headache. You've got chills sometimes. You've got a really bad stomach bug, and you're just not getting better. You go back to the doctor, and finally they do a blood test. And they check and find that you have drug-resistant typhoid. And that will require a much stronger drug and a longer period of taking drugs to cure. But you do get those drugs, and it costs quite a bit more, but after a course of those drugs, you're feeling a lot better, and you feel like you've learned your lesson, and next time you'll be even more careful. Well, now imagine that you're the villager in Apam, always living with the water that's not so clean, always living with the typhoid in your system, and without access to the more expensive drugs. They take Cipro very frequently. Sometimes it makes them feel better for a few days, but then the typhoid is back. This is a drug-resistant form of typhoid. It is difficult to cure. It takes much longer drug treatment and much more expensive drugs that are generally not available to the villagers and other people that live with these resistant pathogens. This is the problem of drug resistance. It is a global problem. We all are exposed to it, and it is across many different diseases: malaria, tuberculosis, HIV/AIDS, typhoid, respiratory diseases. Many diseases have drug-resistant pathogens that are running around the world now. We can prevent it and we can contain it, but we're not doing that. And we need to do much more and be more aggressive in addressing the problem of global drug resistance in order to get the very best out of the drugs that we have available to us and that are being provided by donors and by governments in developing countries to cure the diseases of the poor. We've posted today on the CGD website the Drug Resistance Working Group consultation draft report. We invite your comments on it. It's a consultation draft meant to invite input, suggestions, and recommendations from you. Please do read it and give us your suggestions on our website and by email. Thank you very much.